Yeah, hi, I'm Dr. StephenScionti. I'm the director of the Scionti Prostate Center in Sarasota, Florida. Now, at our center, we've specialized for many years in precision MRI guided targeted therapies for prostate cancer. And so, when we talk about prostate cancer and design treatments, it's so important to understand tumor size, tumor volume, tumor location, and where that tumor fits in relation to really important structures within the prostate. So Unfold AI gives me a really nice way to visualize to myself and to my patient the landscape of their tumor within the prostate. Where does that tumor live in the prostate? How big is it? And really, how much of the prostate do I need to treat to ensure we're getting rid of all the significant cancer? And so it's an incredible tool to help understand, where the cancer is and how to design a treatment. And more specifically, how much of the prostate do I really need to treat in order to get that right balance between cancer treatment and preserving quality of life. So at Scionti Prostate Center, we've prided ourselves on leading the technological revolution in the diagnosis and really the precision treatment of prostate cancer. So I'm always on the lookout for innovative technology. So this started years ago when we thought that MRI was a critical part to diagnosing and planning prostate cancer treatments, and now in fact guiding our prostate cancer treatments. Unfold AI really fits exactly along this pattern of technology innovation. The ability to take the information we get from a precision mapped biopsy using technology like Artemis and converting that into a three-dimensional map demonstrating tumor location and probability of tumor in different locations of the prostate. That's a huge leap forward that takes what I think I've learned in my mind over many years and helps to validate what we think we know with really high-tech AI-derived information, which gives us a very reliable understanding about where the tumor lives and really how to craft exactly the right kind of treatment. So in in a group in which we really value, high-tech advanced approaches, Unfold AI is a perfect fit at the Scionti Prostate Center. It fits beautifully into our workflow. And what it does for our patients, it allows us to bring the most up-to-date, most cutting-edge, most sophisticated technology into designing and treating their prostate cancer. The patients that will benefit the most from Unfold AI are those in which we have a whole range of treatment possibilities, and then we have to fine-tune that treatment to the tumor location and size and to the patient preferences. Now, for example, if a patient has one little tiny bit of slow-growing cancer, and we know it's in a very small area, we know that that patient's going to be well managed with something like active surveillance. I don't really need Unfold AI to tell me that. At the opposite extreme, if we have a patient in which the tumor occupies the entire prostate and it's an aggressive, high-grade cancer, we know that the patient needs an aggressive approach. Unfold AI doesn't change how I'm going to treat that patient. But most of the patients don't live at those extremes. They live in the middle. There are patients who have a middle ground or intermediate risk cancer, and then the decision we have to make with shared decision making between the surgeon and the patient is, where's the right balance between treating the cancer, how much of the prostate do I need to treat, and I've got to weigh that against with the patient, their preferences. How important is maintaining full sexual function? How important is that you maintain, full, excellent urinary function? And so it's that blending of patient preference with a really good, solid understanding of where that tumor lives in the prostate and where the tumor areas are likely to be. It's those middle ground patients, and those are frankly the most common patients we see today. They live in that intermediate range in the middle. And so I think this is a tremendous advantage for those men. And it just helps us to give the patient better advice and helps me as the surgeon to craft a more precision-based treatment. Unfold AI is incredibly helpful in terms of determining, what types of treatments a patient's a candidate for. And again, really comes down to how much of the prostate really needs to be treated. Now, in some patients, it's very clear that the entire prostate will need a total gland treatment approach. And Unfold AI can help to confirm that. So if we see a tumor map that encompasses the majority of the prostate, that really confirms to the surgeon and to the patient that they need a more inclusive total gland approach. That may be for in traditional cases, it might be surgery or radiation, or it might be using a total gland ablation approach such as TULSA-PRO prostate ablation, where I can treat the entire prostate. On the other hand, there are patients who may have a very regional tumor. We know we have high confidence and then confirmed by Unfold AI, the tumor is regional, it's what we would call focal, and then we know the patient's going to be well served by a more targeted precision approach. Now, which tool I use can also be heavily influenced by Unfold AI. If we see a high probability of tumor, for example, in the anterior, the top part of the prostate, now I've got to use a tool that can get energy to the anterior prostate. So now I'm thinking about something like TULSA-PRO or cryoablation. If I see a Unfold AI prediction showing tumor only in the posterior region, that's a perfect situation for using transrectal MRI-guided HIFU treatment. So again, having more information about tumor location, the probability of tumor in different locations of the prostate, helps you determine how much of the prostate will treat, whether total gland, hemi, partial, 1/2, 3/4, 25%, whatever, and then what tool to use to get energy to that area. So it's incredibly useful, providing more information to guide those real personalized treatment decisions. Again, the goal here is to find the best option for my patient that will get the best cancer control and balance that against preserving as much quality of life as we can preserve. Unfold AI is incredibly helpful in helping to really determine how aggressive an approach we need. And then conversely, that really implies that we really want to know, how much of the prostate we can preserve, or how much we have to treat. Now that's important when you talk about something like margins. Margins are the edges of your treatment. So the most common way that a focal therapy or a subtotal treatment will fail is because not where the energy is concentrated in the middle of the tumor, with high reliability, that cancer is going to be gone. Whether I'm using TULSA, HIFU, cryotherapy, laser, doesn't matter. Where we see recurrences, really with any treatment, particularly with subtotal or focal therapies, is at the edge of where the treatment is. That's what we call the margin. Now, one of the things that it's hard to estimate with high confidence is how big of a margin do we need to create? The more margin I create, the more side effects there can be because I'm treating the larger amount of the prostate. But if I see, for example, that there's an 85% to 90% chance that the cancer extends all the way out to the edge of the prostate, and I know I need to treat the edge plus a safety margin around it, that's really important information because if I don't know that, I can undertreat my patient and have a very high risk of recurrence at that margin. So in terms of designing a treatment with the least likelihood of a marginal or recurrence at the edge of the treatment, having a software that's based on these advanced AI algorithms, that can help me design my margins, my boundaries, the safety zone I need to put around the tumor treatment zone. That also is important in terms of expectations, particularly regarding urinary and sexual functioning. So, for example, if I can reliably keep a treatment away from the nerves that allow for erectile function, and I know I can do that safely, I can tell my patient, you've got an extremely high chance that you will maintain very normal erectile function. The opposite of that is if I know that the tumor is likely to involve that nerve bundle and I need to be more aggressive, I can tell my patient that we can expect we're going to have some decrease in erectile function in order to get good cancer control. Unfold AI can help me understand that and help me counsel my patient appropriately. So again, designing treatment with minimal recurrences, controlling proper margins, and helping my patient understand how are they going to be? How are they going to function? How is everything going to work? What can you expect from your treatment? This is a very, very useful tool. So at the Scionti Prostate Center, the goal we have with every one of our prostate cancer patients is participating in what we would call shared decision making. It's not about, as the surgeon, what I think is the only way to treat the patient. It's the patient understanding, me helping my patient understand where the tumor is and what the likelihood of tumor being present in just a small part of the prostate or involving more of the prostate. And then from the patient's side, what's important to my patient? Is it a very high priority to have a minimal chance of ever having to do another treatment? And that is, are they prioritizing non-recurrence? Or is it important to say, okay, I'm willing to accept a little more chance of recurrence, but I want to function normally? So where that balance is the discussion we have to have with everybody. And that's that shared decision-making process. Having a tool that graphically shows my patient where the tumor is and where the probabilities of cancer are within the prostate helps me to have that conversation about just how aggressive or non-aggressive a treatment I need to design, and then helps my patient to understand where they fit on that spectrum between cancer control and maintaining normal function. So again, there's no substitute for having more useful and helpful information to guide these decisions. And that's one of the things that I think Unfold AI is incredibly helpful for. Where do we go in the future with this? So having more information that any prostate cancer physician can give their patient is incredibly helpful. As a patient, the more you understand about your prostate cancer, the better decision you can make. So any tool that can be incorporated into our standard workflow process that helps to reinforce the doctor's confidence about where the cancer is and the patient's understanding about the status of their cancer, I think leads to people making better decisions. How do you as a patient make an informed decision with incomplete information? You know, one of my mentors used to tell me as a young surgeon, he said, there is no substitute for getting complete and proper information. You need to make a precision diagnosis. It's only with precision diagnostics can you design really a precision approach to treating someone's prostate cancer. And my hope and belief is that tools such as Unfold AI will help to better inform both the surgeon and the patient in terms of better understanding, better precision diagnostics, and a better ability to choose what the most appropriate type of treatment is. So I think that we will see a day in which using this advanced AI technology will be really a routine part in that understanding of cancer and how to treat it between a patient and the prostate cancer treating physician.